Hello and welcome to Kaweah Delta's bi-weekly community webinar. Today is Thursday, April 8th. My name is Deborah Volleson and I'm the Director of Community Engagement for Kaweah Delta. I'm joined today by Gary Herbst, our hospital CEO, and we're going to cover the questions that have been submitted throughout the week. And of course, we will answer chat lines. I've got my email open if anybody needs to email me. But there are great things happening here at Kaweah Delta, and we have Tulare Clinic opening, we have our ED getting ready to open, our COVID numbers are low, county numbers are low, the weather's fabulous, and all things are pointing to seeing a light at the end of the tunnel. And so there's an air of excitement here at Kaweah Delta, and I hope I'm not the only one feeling that, Gary.
No, I am
feeling
too.
Excited?
Absolutely, yes. And I can't, I don't remember. You always keep track of the exact number of telecasts that we've done, but it's probably approaching 50.
We are approaching 50, yeah.
I will say of all the telecasts that we have done over this entire pandemic, that this might be one of my most positive ones I give, but actually I hope that I make even more positive reports in the future, because there's still continued opportunity for improvement and the final closure of the pandemic, but things are definitely going in the right direction.
Right. We met with our employee ambassadors last night, and I feel like just everybody is ready for something new. We're ready to just come out of this with a renewed hope, just a renewed vision of the hospital. We are ready. We're ready for new stuff.
We're beyond ready.
Well, and
we're past ready.
Well, and I think last year with COVID, and we've talked about this a lot of times on this call, the employees had to get used to constant changes.
Right.
We would go from 1 hour talking about PPE in this manner, and then the next hour something changed. So it is sometimes events like that open us to change. It's just the world is our oyster right now, Gary.
Yeah, well, there's no doubt about it that our levels of creativity, innovation, flexibility, fluidity, we've taken to a whole new level. And actually, that has been probably one of the most remarkable, most inspiring things that I have personally witnessed over this pandemic, is just to watch our leaders here, our organization, just their ability to zig and zag and confront very complex issues that none of us have ever faced, and to do it with such effectiveness, and it is truly inspiring.
Right, and we're not prepared for this, but I do want to throw this in there. In our employee ambassador meeting last night, we shared about the ASC. I believe it's the ASC survey, ACS survey that we just passed, and the trauma ladies were in there kind of telling us about it, and they said, we had no hope, but our team banded together, and what we thought was an impossible thing to overcome, we passed with. So if you want to share a little more about that.
So Kaweah Delta is a designated level 3 trauma center, and we actually are accredited by the American College of Surgeons, which is voluntary. So trauma centers do not have to be certified. You can still provide trauma and call yourself a trauma center, but those like us that really want to rise to a whole new level and a standard, we go through that very arduous, triennial survey. We had two top level, level 1 trauma surgeons that spent 2 full days at Kaweah Delta. It was done virtually, but walking around with cameras, and they test you in so many areas, and definitely, to have the survey when you're 1 year removed from the pandemic, or you're just at the end of it, it definitely caused us concern that maybe we wouldn't succeed, that we wouldn't pass the survey. But it was so rewarding, that exit conference with the 2 surgeons. Number one, they said we found 0 deficiencies. But as we fully expected, definitely some opportunities for us to improve, particularly in the whole performance improvement area. But they were remarking on our whole blood product management system. And they said they found it to be remarkable and world class. They said, you know, everywhere we go, we try to find a nugget. We try to impart education on the hospital itself, but we always hope that we take away, you know, something that is really profound. And they found that our management of whole blood products during trauma was one of the best they'd ever seen. So they were extremely complimentary and intended to bring that back to their hospitals and share it with other trauma centers. So yeah, we were kind of celebrating that that accomplishment last week.
And I was talking to the media relations team today, and I said, you know, we hear all of, you know, we hear little bits and pieces of good things that are happening around the district, but to hear it from their mouths and their lips, they just brought it to life. And I'm like, okay, we've got.
Well, they got all emotional.
They did.
I mean, you know, it was so personal. It was so personal to them. And I remember when we got off the exit call, Carrie Noweski and I ran over to the trauma offices, and they were floating. I mean, they were screaming and yelling and high-fiving, and it was a fun event.
Yeah,
definitely.
Well, that's great. Well, let's get into some of the positive answers that you're going to share today.
I'm ready.
And let's talk about the numbers.
Okay, so I'll stay with my traditional state, county, Kaweah Delta rundown of the numbers. I'll just start by giving you some perspective. So just keeping this number in mind, the state of California is reporting that as of today, although it probably changes every day or hour, we have 39,984,000 residents in the state of California. So just shy of 40 million people living in the state. So good number to keep in mind. We have actually at the state level performed 55.5 million COVID-19 tests over the entire duration of the pandemic. 3.6 million of those that were tested positive. So that's a cumulative positivity rate of 6.5%. So since really kind of the beginning of March of 2020. Sadly, there have been just shy of 59,000 Californians that have died of a COVID-related condition. That translates into 1.6% of those people that contract the virus die of the virus. Another way to look at it is it's 147 COVID-related deaths per 100,000 population. On the very, very positive news front, the 7-day positivity rate, again, those that are still getting tested, what percentage of them are testing positive? And over the last 7 days at the state level, we are all the way down to 1.8%, which is identical to what we are experiencing in Tulare County. In terms of another key metric, the number of new daily COVID cases per 100,000, the state is currently running at exactly 5.0 new daily cases over the last 7 days. So keep that number in mind. At the state level, statewide, 5 per 100,000. So in terms of the number of COVID patients that are currently hospitalized, those numbers continue to decline significantly. Just shy of 2,400 Californians that are in a California hospital right now with COVID. Only 527 of them, or about 22%, are in the ICU. So I don't remember, you know, how, I mean, we were hovering pretty consistently close to 30% of hospitalized patients were in the ICU. So 22% is still a pretty high level, but it definitely continues to come down, and even more dramatically here at Kaweah Delta, when I'll touch on in a moment. And right now, statewide, 31% of ICUs across California hospitals are currently open and available. And you remember that it wasn't too long ago that the governor had issued the second stay-at-home orders when ICU availability had fallen below 15%. So it's statewide now, we're above 30%. There also have been 21 million doses of vaccine that have now been administered statewide. 7.9 million folks are now fully vaccinated. But again, remember, we have 40 million people that live in the state of California, a little over half. So 21 million of them have received at least one dose of vaccine. And now, because of the declining numbers really across the state, there are only 2 counties that are still in the most restricted Tier 1 purple category under the governor's blueprint for a safer economy. Interestingly, Merced County, just to the north of us, and Inyo County, just right next to Tulare County, are the 2 counties that are still Tier 1 purple. We have, let's see here, 22 counties are now in the red, 32 counties now in Tier 3 orange, and 2 counties in Tier 4 yellow. So that darn Alpine County continues to be one of those counties in the yellow tier, and Sierra County has now joined them. So both counties up in Northern California, kind of in the Sacramento area. The state is also reporting that it currently has 3 million doses of vaccine that are sitting in its inventory, waiting to be distributed. So the state continues to see more and more vaccine, and we definitely are seeing that at the county level too. So moving to Tulare County, we have now conducted 489,000 COVID tests since the inception. 49,188 of them tested positive for the virus. That is a 10.1% cumulative positivity rate. So higher than the state's 6.5% for all the reasons that we've talked about in the past. We have had 814 COVID-related deaths since the beginning of the pandemic. That equals 1.65% of all those COVID positive patients, so virtually identical to the state. But in terms of deaths per 100,000 population, we're at 168 versus 147. So that gap is definitely narrowing. We definitely are seeing fewer and fewer COVID-related deaths in Tulare County. I mentioned that our 7-day positivity rate for Tulare County, again, the percentage of those that take a test, that test positive, we are all the way down to 1.8%. It doesn't seem like it was that long ago that we were well in excess of 20%. There are 24 states in the U.S. that right now are actually seeing 15 daily new COVID cases per 100,000. So if they were in California, they would definitely be Tier 1 purple. But it's just phenomenal to see our positivity rate in this county decline so much. And our number of daily new cases, and again, I remind you, 5.0 at statewide level, we are down to 3.1. In Tulare County. So incredibly low, lower than the statewide average. Again, it's hard to conceptualize that when, again, it wasn't that long ago, we were 20-something plus, and we were so far from moving out of Tier 1. So that is fantastic. And then also our health equity positivity rate. Again, taking that quartile of Tulare County that has some of the poorest health factors, tends to be a very impoverished area of the community, and definitely greater difficulty in accessing COVID testing and vaccines. Their positivity rate is all the way down to 2%, so almost equal to what we're experiencing countywide. So just looking at, so those 3 metrics. Those 3 metrics are what determines what tier, what color tier that you're in. The positivity rate and the health equity positivity rate at what I just referenced would actually qualify for us to be in the yellow Tier 3 category. So the only thing that is keeping us from moving from orange to yellow, and yellow, excuse me, that's tier 4. Tier 4, yellow, the most open. There is no more category beyond that allows your society and your business to open up more. It's almost, you almost get back to pre-COVID conditions, although there's still, you know, social distancing and masking and hand washing and everything, because we don't want a fourth surge to emerge. But if we can get our number of new daily cases down from 3.1 to below 2, and we keep those other 2 metrics where they are right now, then Tulare County will join Alpine and Sierra County as being the only counties that are in that tier 4 yellow. So congratulations to all of you and our entire county for just what has been accomplished between last December and today. It is truly remarkable. Okay, I did want to talk about, well, I think you're going to ask me questions about
hospital.
vaccines. Oh, yes.
Hospital numbers.
Okay, I was going to talk about vaccinations
What's going on around here?
At the county level, but I'll save that.
Let's save
so, so at Kaweah Delta, we continue to be incredibly busy. This morning, we reported an adult acute inpatient occupancy rate of 89%. So still very, very, very busy, very full. We had 14 ICU beds open, 15 ICCU beds open, but only 3 of our 237 medical surgical beds were open and available for admission. And on any given day, we have anywhere from 5 to as many as 25 of patients that are coming into the emergency department that need to be admitted, but we're having to hold them in the ED for beds to open up. So we do continue to be incredibly busy. And I think what we're observing is a lot of folks that have underlying chronic diseases, again, afraid to leave the house, afraid to come to the hospital, their conditions are worsened. And now when they present to the hospital, what might have been able to be treated on an outpatient basis is now resulting in an inpatient admission. So that's essentially been our observation and experience. On a COVID standpoint, we only have 17 COVID positive patients in-house. They're all adults. We don't have any children with COVID that are in-house right now. And of those 17, only 3 are in the ICU. Only 2 of them requiring to receive mechanical ventilation through a ventilator. So we actually were at 15 yesterday. So we had 2 new COVID admissions, which tells us it's still out there. Yeah. It is still out there. And hospitalization's one of those trailing indicators. So even the positivity rate is plummeting. We still are seeing new daily cases, and some of them are still ending up in the hospital. But that's a very good sign. And then also, we only now have 16 of our employees who are out on a COVID-related leave of absence. Interestingly, 12 of those 16 have been on their COVID leave prior to January 1. So they actually went out before the beginning of the new year and have not returned yet. We don't have any employees that have been hospitalized. We don't have any providers, physicians or APPs that are out on leave. So I don't know if they're just having a longer, more difficult time in recovering, or aren't ready, to come back yet and have extended their leave. But we wish them our very best to all of them. Yes. The last thing, I meant to report this at our last get-together here. I thought you might find it interesting. I have talked about that the flu has essentially been non-existent this year, which is interesting. Because we definitely would attribute it to the hand washing, the face mask wearing, the social distancing, not gathering during the holidays, which is usually kind of the peak of flu season around Christmas and New Year's and so forth. And I can only assume that that's really what's dampened it this year. The flu season for us, for record keeping, officially starts on November 1st and generally runs till mid to late April. I get a weekly report from Kathy Whitman, who's our infection prevention manager. And this week she sent to me her report that shows since November 1st all the way through April 3rd, we have had 949 patients who have tested positive for the flu. So it's still a lot, just shy of 1,000. Most all of it has been influenza B with a little bit of A. But of those 949, only 18 of them have been admitted for the flu. Generally, in any flu season, we will have close to 400, if not more, flu-related admissions. They tend to be patients that did not get vaccinated for the flu, but to only have 18 out of almost 1,000 people that got the flu. So they came into our clinics, they came into the ED, they came into urgent care centers where they were swabbed and tested positive, but they were able to be treated at home and not be admitted. And then lastly, we've had 192 patients. So 192 of those 949 tested positive for both COVID and the flu. And 6 of them had to be admitted. So 6 of the 18 that were admitted for the flu also had COVID. So just thought it was somewhat of a fun fact that I would share with folks. So that's where we are from a number standpoint.
Yeah, because people, that's part of the conspiracy stuff is that, so the flu just magically disappeared. No, it didn't disappear.
Right, it wasn't magically. Yeah, it's still here.
It's still here.
It's still here, yeah.
Yeah. When does flu season officially end?
It depends. We're still seeing about 50 cases a week. So Kathy's wants to continue what we call the surveillance period a little bit longer. I suspect that we'll stop by the end of April, will be the official end of the surveillance period.
Okay, perfect. So let's talk vaccines. So a couple of weeks ago, I believe we had talked that, or we had said that the vaccines were going to slowly start rolling out to our rural clinics. Has that happened?
No, not yet. Yeah.
Okay.
So it's about to, though.
Okay.
So I had a sections chief meeting yesterday, and Ryan Gates and Jessica Rodriguez kind of briefed our team on our current ability to vaccinate our community, which we are now offering vaccines to the entire community, the general public, so not just employees and providers or patients that are established with us. This is open to the entire community. So we're currently administering about 100 doses a day of both Moderna and Johnson & Johnson vaccines. Remember, Moderna is a 2-shot vaccination, 28 days in between the 2 doses. Johnson & Johnson is a single dose. We're not receiving any Pfizer vaccine at this point.
Does the county have Pfizer?
I don't know. They may, but Moderna and Johnson & Johnson seem to be the vaccine that's most available right now.
Well, somebody called me yesterday and said they had received their first dose of Pfizer, but they didn't schedule them for their second dose. And they asked me, am I going to have a hard time finding a second dose of Pfizer?
I don't know. So were they vaccinated by the county or by another provider?
They were at a COS event.
Yeah, I would imagine they won't have a difficult time because the county has been very good at making certain, any first doses of either Moderna or Pfizer that they will absolutely have an inventory that second dose. I've not heard of anybody that literally was not able to get their second dose of that vaccine.
All right, good to know.
So the 100 doses of vaccine that we're doing daily, so that's at our urgent care center on Court Street. So that has been our singular vaccination site up to this point. But starting next Monday, April 12th, we will begin offering only the Johnson & Johnson vaccine at our urgent care center on Demery. Just because of the logistics of trying to schedule and coordinate that second dose of Pfizer or Moderna, we've decided at the Demery Urgent Care Center we're just going to do Johnson & Johnson. And there'll be a little bit more limited hours that the vaccination is available, and we're expecting that we'll probably vaccinate about 50 people a day at the Demery site. And then shortly after that, we will deploy the vaccine, and again, this will be both Moderna and Johnson & Johnson, to our 5 rural health clinic sites. So that could happen maybe just in a couple weeks. And we're anticipating that we'll do probably on average about 80 doses at each of the 5 sites on a daily basis. And again, to schedule an appointment at any of the Kaweah Delta sites, you go on to the state's My Turn scheduling platform, and you'll see our sites as available sites, and you can schedule your appointment, and we hear that it's working pretty smoothly now. So.
Okay, that's great.
So you had a second part of the question that
the percentage of the county.
Yeah, so I was going to talk about that earlier, but I waited here. So, so the state of California has pegged the population of Tulare County at 484,423 people. You can't find that anywhere by Googling Tulare County population. But if you're able to drill down like I did deep into the state's databases, that is the population they're using to calculate all of our various metrics. So when we talk about daily new cases per 100,000 population, it's that 4.84 is the number of our 100,000 population groups. So of our population, 61.7% of them are 18 years or older, which is kind of the target population right now for getting vaccinated. In fact, I can't remember if it's Pfizer or Moderna, but they don't allow you to vaccinate anybody younger than 18. One of them allows younger or as young as 16.
Right.
But then they're also working on a vaccine that may go all the way down to age 12, potentially even below. Because you think about it, we do vaccinate children for the flu at very, very young ages. So at 61.7% of the population, that's right about 299,000 Tulare County residents are 18 years and older. And so you'd say, okay, that's the population that we're trying to immunize. So the county just yesterday reported that it has administered 118,453 doses of vaccine. So if you do the math, that means 39% of the eligible Tulare County population has received at least one dose of vaccine. And even the one dose has been proven to provide a pretty healthy level of immunity. But at 39%, that is still well below what is being defined as herd immunity. So herd immunity being anywhere from 70 to 80% of your population has been vaccinated or has natural antibodies because they contracted the virus. So we definitely have a lot more work to do, a lot more vaccination to occur, and definitely encouraging people to attend, one of the Tulare Ag Center mass vaccination events, or COS, Porterville. If you go on to, again, that My Turn website or even the county website, there are many, many places that we can now be vaccinated. And in fact, Tulare County has more than 30,000 doses of vaccine in its inventory.
So are we still not seeing the horrible side effects that we've been asked about?
I haven't seen any horrible. I hear stories, even on our employee huddles, where an employee stated that a colleague employee coded after the vaccine and had to be admitted. And I asked the executive team on Monday if they had heard something like that, and nobody had. Our chief nursing officers, I mean, there was a lot of media, activity out there at when the vaccines were first being administered, and a lot of claims that it was causing severe, death, and we just don't see it. There definitely, as we've talked about, there's some rough reactions.
Right.
I'm hearing that people that had COVID and recovered from it, that when they get the vaccine, which the CDC encourages them to still get, their reaction is stronger than most because they already had probably a pretty good antibody presence to begin with. But
that was not the case with us.
I thought with your children, though, didn't you have?
My children, all three, got sick.
Yeah.
And they're all in their 20s.
But they had COVID, right?
Two of them had.
Right.
My other one did not have COVID, and they all three were sick. Fevers. One of them was throwing up, but it was
Right.
like a short period of time.
A day and a half.
Nick and I, we both had COVID. Maybe a sore arm.
Okay.
A slightly sore arm. It wasn't really anything to even
Right.
brag about. We didn't even have bragging rights.
Yeah, and I said I didn't have anything,
Yeah.
first or second shot, not even a sore arm.
Yeah.
My 84-year-old dad, I think he got the Moderna vaccine. He had zero reaction, both first and second shot. But then the most common is a sore arm, body aches. I just feel
fever.
tired. I feel body aches, but then fever, chills. We have
Right.
heard of throwing up, but I have not heard of a single employee or community member that had to be hospitalized for a reaction to the vaccine.
Okay, that's good. That's really good. So let's talk about COVID testing. So are the numbers really low for people accessing our COVID testing?
Yeah, they're, I wouldn't say really low. They definitely are falling. So March, we did about 12,000 COVID tests, which over the last 4 months is the lowest that we ever administered. And then April, we're, 8 days into it. It's very, very slow. It actually might come in under 5,000 by the time that the month ends. And that's probably expected with so many people and the focus now on getting vaccinated. In fact, we made a decision yesterday that at our Exeter, Lindsay, and Dinuba clinic, we had rented these big HVAC-equipped C-trains that we placed on the campuses that were dedicated to COVID testing, where patients could come in a safe environment, safe for our staff, safe for them, and get COVID tested. We're now going to remove those by the end of the month. However, we're going to continue to offer COVID testing at all of our sites. So even though the C-trains are going down, we will now just incorporate it into our normal workflow. So if somebody wants to get tested for COVID, wants to go to the Exeter Clinic or Lindsay or Dinuba, you still schedule an appointment, you can still drop in, get a COVID test. We're going to try to concentrate COVID testing at our urgent care centers on Court and Demery. But, and I know Visalia Medical Clinic is still doing COVID testing. And I don't know when it will stop or if it will ever stop. Because we test for the flu every single year. We have all of the BioFire and BD Max now. We have all these laboratory platforms. We now have all the ABC test kits where it's testing for influenza A, B, and COVID. So I think COVID testing will pretty much always be available to our community and at those various sites, but it just won't be, like this COVID testing center that you come to.
Right.
It'll now just be part of our operations.
Right. Okay, so have we made any updates since our last community webinar to our visitor policy?
Not yet, but we're on the cusp of doing it. We, again, kind of waiting to see where our county was falling. So definitely now that we're in orange, tier 3, that's making us feel more and more comfortable. So I'll quickly the current visitation policy is like in the general acute area, so the medical surgical units, non-critical care, we now allow one visitor per day from 10 a.m. to 9 p.m. So remember, we used to have two-hour slots that you had to fit into. Well, now it's one continuous 10 a.m. to 9 p.m. And you can have a different visitor every day, so they can rotate. In the critical care areas, it's pretty much the same, except we do still have the split hours. So there's a time from 10 a.m. to 5 p.m. and then 7 p.m. to 9 p.m. These are for COVID negative patients. We do allow visitors to see their loved ones who are positive for COVID and are in isolation, kind of under our exception policy. So end of life, deteriorating conditions, impaired mental status, somebody is going to have or just had major trauma surgery, neurosurgery, cardiac surgery, or if if the provider team needs to have kind of a family conference to determine next steps for care. So we have those exceptions for COVID positive patients. And then also the leaders on the nursing units can always make exceptions.
Right.
They've been authorized to do that. In the NICU, we allow 2 visitors from 9 a.m. to 6 p.m. and one of them can stay overnight. In the PEDS unit, we allow 2 visitors 24 hours a day, 7 days a week. And that same, or in labor and delivery, we allow 1 visitor 24/7. So what we're looking at next is starting the visitation hours from moving it from 10 a.m. down to 8 a.m. So we would add 2 additional hours to that time period. And then also looking at moving from 1 visitor a day to 2 visitors a day. So 2 visitors on the medical surgical units, even in critical care, would be allowed to stay during the entire visitation period with their loved one and would allow them to rotate out. So it might be these 2 visitors on Monday and then a different 2 visitors on Tuesday. And so it's probably going to be a couple weeks before we fully institute that. But again, like throughout this entire pandemic, we're making changes to reflect the improving conditions.
And it's going to be different in our halls. For a year, they've been empty.
Yeah.
I remember the first time I walked across through the hospital after we shut down to visitors, and it was just such an eerie feeling of just empty halls. And then, so it's going to be good to see some people coming back.
It is, but I will tell you, it's been interesting. It's certainly given us an opportunity to just evaluate the whole visitation, process. And I was up on the mother-baby unit last week, just meeting with staff, rounding with them, and we were talking about visitation. And you think when a mom has a baby, we normally, we open it up to all visitors.
Right.
Dad, grandma and grandpas, aunts and uncles, children, friends, and but it hasn't been that way. It's been, pretty much 1 visitor now. And moms are delighted. They're saying, I finally get some rest. I can breastfeed in privacy. And they're finding that it's more quiet on the unit and their patients are more appreciative of that. They're only in the hospital, for a normal vaginal delivery 1 to 2 days.
Right.
And they want that time to kind of rest and heal and plenty of time to get home and show off our new baby. And so we'll talk to our patients, we'll talk to our family members, and so there might be some modifications going forward to our visitor policy that weren't there pre-COVID.
Right. So I'm receiving a text right now. Let's go back over end of life. So somebody has a patient in our hospital that's at end of life. So what special exceptions are made for that patient and the family?
So we kind of fall back to the general one, but end of life, again, quite possibly determined by the nursing leader on that unit. perhaps the visitor spends the night instead of leaving at
Do they
9
allow
p.m.
more family members in? Is it something that they make exceptions for? Because that's excruciating.
Sure.
That's so hard for families.
Yeah. And I think, again, it depends on if they're COVID positive or COVID negative. Still, trying to protect the staff. And I don't, in those situations where it is end of life, they're making judgment calls. And they want to be, obviously, incredibly compassionate and sensitive towards the patient and the family. But they have to look at the particular circumstances on the unit.
Yeah. Okay. So COVID variants. We've talked about these. It's almost kind of a bad word to say, COVID variant. Our staff are concerned about the variants. So are we seeing them here in our county?
Well, we know all viruses mutate pretty much. We have different variants of the flu every year, and that's why we're always trying to determine that perfect cocktail in the flu vaccine to hit the particular variants or strains that we expect to see. So the Tulare County Public Health Department did last week, I think it was on Friday, they did report that there had been 3 patients that had been identified, had been tested. I don't know if they were able to do it at the Tulare laboratory because you're actually testing the sequencing and the presence of DNA and RNA, and we certainly don't have that capability at Kaweah Delta. They certainly do at the state level and other national laboratories. But so 3 people were confirmed as having the variant. 2 of them had the United Kingdom variant, which is B.1.1.7. Doesn't mean anything to us, but I think that's the.
But you will remember that number.
It's the DNA sequence spot, probably. Yeah. And we had one a positive patient that had the South African strain of B.1.351. So both variants, but a little bit different. Both of the variants are considered to be more contagious. They transmit easier. And they may be even more severe in terms of how our bodies fight that particular virus. But both Pfizer and Moderna, most scientists, most epidemiologists and immunologists believe that the vaccines that have been created, the current Pfizer, Moderna, Johnson & Johnson, that they're quite effective in battling, these variants.
Okay.
They may not, as we've said, even with the original virus, they don't prevent you from contracting the virus, although more and more evidence is showing that maybe they do, or at least if you have it, you can't transmit it to anybody else. So that's very encouraging. But they all feel that they are very effective in keeping you from getting severely ill and ending up in the hospital. Moderna has just recently started testing a new vaccine specifically to combat the South African variant, because that one seems to be the one that causes the most severe reaction. So they're actually doing a study group right now. It's a completely different vaccine, although I'm sure it's very similar, but then also looking at creating like a booster shot for those that had already received the original Moderna vaccine to get this, I don't know if it would be a nasal spray or another shot, a booster shot, to give you an added layer of protection against the South African variant.
Okay. One of our employees asked this question. We know this is probably going to be a yearly vaccine. Have they made that determination yet?
They have not.
Okay.
They have not.
Has anything been determined regarding booster? So is there every 6 months you need to get a booster if you received it? No?
Again, we really don't know that. There was a belief when COVID first emerged that it was going to be like the flu virus, and that once the hot weather arrived in April, May, it would die off like the flu did. Well, obviously that did not happen. In fact, we had one of our biggest surges in the month of July, right around the 4th of July or a few weeks after that. So it did not die off then, and it still has not died off now. I think what is calming things down is really vaccination and continuing safe practices by our community. So scientists don't know if it will disappear forever like SARS-CoV-1 did. This is SARS-CoV-2. So SARS-CoV-1, that appeared a number of years ago, lasted about a year and a half. We never created a vaccine. We kind of treated it like the flu. It was deadly, but not to this degree by any means. But it died off and has never been seen again. So is that going to happen with COVID-2? It's quite possible. Or does it become a seasonal virus like the cold and common cold and the flu? And if it does, then we'll most likely get vaccinated every year, just like we do for the flu. So nobody knows, at this point. What they have talked about is developing a booster nasal spray because this particular virus, COVID, colonizes in your nose, in your sinus tract, and then makes its way into your lungs, and that's why it's acute respiratory syndrome is what SARS is. So getting a shot in the arm doesn't really send antibodies necessarily up to the place where it most importantly needs to be. So talking about a booster nasal spray that would provide additional protection. So will we transition to that every year? That right now, if you're younger, you can get the flu vaccine as a nasal spray or a shot in the arm.
Right.
But generally that's more limited for the younger population. But so time will tell. I'm amazed by our scientists who have not stopped studying this virus since the very early detection of it. And it's just remarkable what they've accomplished in such a short period of time.
Right. Okay, so our schools opened a couple of weeks ago. On limited basis, we understand, but have they seen any super spread since the schools have opened? Have we seen anything like that here?
I don't think so. I was trying to do a little bit of research on that, and we definitely we had outbreaks in December when we, as a hospital and a nation, were really under surge. We saw a breakout, I think it was at Shannon Ranch Elementary School, where they had to quarantine about 14 kids, and Ivanhoe Elementary School had to quarantine 12 kids. But that was back in December. And since we've reopened, and we do know there have been schools that have been open throughout the entire pandemic, like CVC and
Outside Crete, yeah.
Yeah, and I have not read of any outbreaks at those schools. Not to say that there haven't been kids that contracted it, but since Visalia Unified School District has gone back to some level of in-person learning, I have not read or heard of any outbreaks that they've experienced.
Okay, thank you. So our Tulare clinic was supposed to open on Monday, and it didn't. What was the reasoning behind that?
A little frustrating. Always seems to involve the state and the bureaucracy there. So, so the clinic was completely done, stocked and staffed and everything, and the California Department of Public Health came out and did their site survey. They had nothing but phenomenal things to say. They were incredibly impressed and said, as soon as we issue your new hospital license that lists the Tulare Clinic as one of your sites of service, you'll be able to start seeing patients. So that was supposed to be received on Monday or the Friday before, but it didn't. And the state apologized and said they're a little bit behind, so they told us that it should come yesterday. And I haven't heard if it was received or not.
It wasn't.
You're shaking your head no.
I asked Mark right before.
Yeah.
It hasn't been received.
So, and haven't received it as of today either. Yeah.
And that's just a piece of paper?
It's just a piece of paper.
Just a piece of paper.
Yeah.
Okay,
Yep,
well,
so-
we'll keep our fingers crossed on that because we're so excited.
We
We've been
are.
announcing it.
Oh yeah,
Yeah.
Dr. Fernandez is ready to start seeing patients. And, I know Tulare residents are excited.
Yeah.
We have a lot of our specialists that are reaching out to Ryan Gates, but podiatrists, orthopedic surgeons, vascular surgeons, neurosurgeons that want to have time in the Tulare clinic. So it's going to be a wonderful new asset for that community.
Right. In fact, we have our ribbon cutting grand opening of that facility on Monday, May 3rd at 9 o'clock. So, and we thought
We better be open, huh?
We better be open by then. Well, Gary, our time is up, and so I want to thank everybody. Remember, I will post the recording of this meeting in our Community Engagement Facebook page, and we'll also put the written transcripts on our Kaweah Delta COVID-19 page. But I'm going to let you close this out.
Yeah, thank you, Deb. Just everything you said at the beginning is what's going through my head. What a glorious spring day out there right now. It looks like the weekend is going to have similar beautiful sunny and moderate temperatures. But we're walking around with smiles on our faces these days. I wish we could see them because we're still covered by a mask. So, although when I've been rounding on various units over the last couple weeks, and I'm bombarded with the same question over and over again: is Gary, when can I stop wearing this N95 mask? And this poor nurse pulled her mask down and showed me how raw her face is, because you can't imagine. I know we're discomforted, wearing a surgical mask or a cloth mask. To wear an N95 mask for an entire 12-hour shift is very, very difficult. So I was delighted to inform them that we are likely the week of April 19th, we will transition from N95 masks to a much more comfortable surgical mask for all of our staff, except if you're taking care of a COVID positive patient. Then you have to continue to wear an N95, and I know the staff would want to. So just, today was a great day for reporting positive news, and I'm just, again, so appreciative of all of you continuing to stay with us over this entire year. You deserve, you've been hanging in with us, during the good times and the bad. And so I'm just glad you're still with us so that you get to experience the good part of this, because you so much deserve it. So just want to wish you all a very happy Thursday and a great weekend. And keep your fingers crossed that things continue to go in this positive direction. And I know we're going to continue to do these telecasts in the foreseeable future, but hopefully we'll have opportunities to talk about things other than COVID.
So
have a great day.